Hello, this is Oyena Ogbonna. This is my week 8 coalition project presentation on cervical cancer among Hispanic women in the city of Houston. So let me give you an overview of our community in Houston. Houston is one of the most diverse cities in the United States. It's a metropolitan city and home to a community that shares diverse attributes. So health issues vary based on differences in the community. And the main health issue that has necessitated this health coalition project is cervical cancer, especially when it comes to Hispanic women. Studies from different states and cities, including Houston, has indicated a high rate of cervical cancer incidence among Hispanic women when compared to other ethnic groups. In Houston, the cervical cancer incident rate is estimated at 14.6 among Hispanic women, and this study was done between 2011 and 2015. So this is about 33% above the overall rate of cervical cancer incident rate. The focus of this project is to create a cervical cancer coalition that brings stakeholders, including Hispanic community leaders, influencers, and other communities and health professionals to help in disseminating information to the women in this community, on the importance of adopting health promoting behaviors. So let's discuss behavioral and environmental factors. There are a couple of modified determinants that could explain the high incident rates of cervical cancer among Hispanic women. These determinants can either be behavioral or environmental factors. So when broken down into small categories, these include social factors, physical factors, financial factors, and cultural factors. There are also several factors that are characteristic of Hispanic women and may explain the low uptake of cervical cancer screening. The specific modifiable determinants that may prevent these women from utilizing screening includes lack of regular health care, lack of awareness about prevention services, lower socioeconomic status, inadequate health literacy, low acculturation, cultural beliefs, access barriers, low education, and structural barriers. Relevant theory-based interventions. So one of the most relevant ways curbing this problem, is making sure that women understand the need for pap smears, annual pap smears. The awareness may be hindered by one of the mentioned modifiable factors, Therefore, the need for a theoretical based intervention to help the Hispanic women's increase in cervical cancer screening behavior and sequentially lower incidence disparities. In particular, this will help modify cultural beliefs and improve acculturation towards seeking medical information on cervical cancer screening. The coalition project aims to utilize a technological advanced intervention since it's part of every community in the United States. So due to the increased acceptability of smartphones, mobile message screening or M screening and related app interventions to raise a significant increase of cervical cancer awareness, guidelines of screening, and increasing receipts of pap smear tests with a notable level of satisfaction from the participants. ASCCP mobile and pap reader apps are also important in administering cervical cancer screening. For example, the ASCCP mobile provides follow-up guidelines and has a support system that uses patient information tailored to specific cases, which can promote planned behavior. The aim is to promote the use of pap smear tests for cervical cancer as a way of controlling mortality rate among Hispanic women. Theory of planned behavior, TPB, will suffice as it provides a framework for addressing, facilitating, and inhibits behaviors that may affect the intent of performing the pap smear test. So, simply stated, the TPB framework encapsulates the subjective norm constructs and measures the perceived behavior control. The matrix below indicates also how the TPB will help over subjective norms such as cultural barriers in promoting awareness and the intent to perform cervical cancer tests. So you can take a look at this. This table here discusses personal objectives and Hispanic women's attitudes in utilizing preventative measures and people who are likely to listen to other natural supports in their lives in booking appointments for pap smears and so on. So recommendations for this coalition project is to use mobile applications such as M-screening among the Hispanic women in Houston to increase literacy about cervical cancer and impart the need to be tested. Smartphone applications work easier because they're not deterred by cultural beliefs when, compared to the way people respond when they interact with other individuals. On the other hand, acculturation of technologically driven health promotion is a new thing, which women can easily get hooked to during the current due to the current smartphone frenzy. Everybody loves using their phones, and this is actually more accessible and user friendly uh, as opposed to meeting with a doctor one on one for them to get screened. To measure the effectiveness of this approach in preventing cervical cancer, a pre-post intervention methodology should be used. In this case, the pre-intervention cervical cancer incident rate and pap screening turnout will be compared with the post-intervention cervical cancer incident rate and pap screening turnout among the Hispanic women. Thank you very much for listening to my presentation. My references are available in the original submission. Thank you again.